Hi guys, hope you are. Super quick video about the RCA, the Recorded Consultation Assessment. What is it all about? It's the replacement, of course, for the CSA exam, the temporary replacement. Yesterday, the RCGP released some information and people have been asking me a lot of questions about what it all involves. So this video is all about what do we know so far, and of course things can change going forward. How to get started, what are some key tips to think about to get this thing moving, and number 3, how we can support you through this whole RCA process. Let's start. So who is it for firstly? It's for those GP trainees who are due to finish before 30th of September this year, so CCT before 30th of September, and for those who haven't done their CSA exam yet. There are quite a few trainees who had the CSA to go before all this pandemic happened. Now, of course, we can't do the CSA in its normal format because you can't go and sit in that center and do the exam as normal. So it's an alternative assessment for those trainees who need to have finished CSA before 30th of September. So what is it? In essence, it's about you recording consultations, sending them across, and someone examining them from a remote, separate place. Of course, in the CSA, you sit there and you're assessed by somebody sitting right next to you. That can't be done. So now you've got to record consultations and send them and get them marked by CSA examiners. So people who are already used to examining for the CSA. The criteria that you're going to be marked against are the same as the CSA. So looking at things like how do you gather data effectively? Can you use evidence-based decisions in your consultations? How do you communicate? Is it effective? All these kind of things are going to still be looked at, but from remote consultations. We'll talk about what those are in a second. So what are some of the details that we know so far? So in essence, you need to record 13 separate consultations. These could be face-to-face consultations in real life, it could be video consultations in real life, or it could be audio, telephone consultations in real life. So you've got to record them either in video format or in audio format, and then submit these using a central platform, which is still being finalized right now, for them to be marked by CSA examiners. Now, these need to be approximately 10 minutes. It's not that in the CSA, for example, the bell will go at 10 minutes, whereas here you've got approximately 10 minutes. Of course, these are real life consultations and you can't have them at 10 minutes on the bell, but bear it in mind, they need to be approximately 10 minutes in length. Now, these need to cover a range or a broad range of the curriculum. You've got to try and demonstrate your ability to manage conditions across the whole GP curriculum spectrum. So for example, you're looking at a range of different conditions or presentations. You need to be looking at a range of age groups. You need to be looking at including a few key things like a mental health presentation, an urgent care presentation, preferably a long-term condition presentation. So you've got to try and somehow in these 13 scenarios demonstrate that you can manage a wide range of presentations and topics that are covered by the curriculum. Now, the cost is going to be the same as the normal CSA exam. So there's no difference than if you were taking the CSA exam in terms of cost. Now, normally with the CSA, you get 4 attempts. This is counted as an additional attempt to those 4 attempts. Now, in terms of recording, you can use your own phone or own device. There's no problems with using your own system. However, you've got to do some basic things like get consent, and we'll do some more guidance on how to get consent going forward. You need to make sure that the recording is continuous. You can't kind of stop it, pause it, edit it, change it in the middle. It's got to be a continuous stream. And also, if you've got some old videos, you can use those as well. You don't have to just use ones that you do from today. So if you've got old videos that may fit this pattern that you're looking for, as long as you haven't used them in another assessment, like a COT, for example, then you can submit those as part of your 13 consultations. Now remember, once again, they're looking at the same 3 domains that are looked at in CSA: data gathering, interpersonal skills, and clinical management. Now you get marked on these 3 things just like you would be doing in the real exam. So when you're recording these consultations, you need to bear these 3 things in mind. It's worth remembering also that you don't need to have a spread in terms of type of consultation across your 13. You could have all 13 video consultations or telephone consultations. You don't have to have any face-to-face. Now, someone might be shielding, for example, so you're only doing consultations on video or telephone. That's fine. You just need to get 13 separate ones. There's a lot of flexibility given the way that we're currently working and the way that general practice is currently functioning. Just remember, in a remote consultation, of course, you're not going to be doing examination. So if you get a scenario where you'd normally be examining someone, then as part of your consultation or your recording, you need to be explaining this. What examination are you likely to be doing? What are you likely to be looking for? And what's the rationale behind the examination that you normally would choose to do if someone was probably face-to-face, but you're consulting remotely, so you can't physically do it. But you need to still show the thinking behind the examination process and what you would be thinking of doing. So a couple of key tips to get things started, get things boosted, just to start you moving along this path of this new assessment that everyone's a little bit worried about. Number one, talk to your trainers. Go and have a detailed talk with your trainer, digitally if needed, and talk about the process. They're probably learning about this process themselves. How can you two work together to help you make this as easy as possible? Talk about maybe time of consultations. Can you have a little bit longer at the moment because you've got to get extra things done like consent and digital recording, etc. Talk about how maybe they can look out for appropriate cases that they can send to you or put on your list, for example, that help to cover the breadth of the curriculum. So go and talk to your trainer number one, because they're going to have to be a partner with you in getting this assessment done. It can't just be done simply on your own. Number two, get recording. Just start. Just get your, you can use your phone. Just start recording, because the first few are going to be a little bit odd and it's going to be a little bit strange, but the more you do, the more you're going to feel natural about it, the more confident you're going to be about it, and probably the better consultations you're going to end up with. So don't try and get everything perfect first and then start. Just start recording. Even if you throw away or delete the first 50, I know, hopefully not the first 50, but just start. Don't wait for things to be perfect. We don't know everything about this yet, but it's just worth getting used to having that camera on you, used to doing the consent, making the whole process as quick as you can. Number three, make sure you really take this as an opportunity. This is so important. A lot of people are saying, oh, I can't believe we have to do this, have to learn a new thing, and then, it's so late in our GP training pathway and then all this new stuff is coming. Look, it is difficult and it is hard to adapt to new things, but just grab it as an opportunity, okay? Just get ahead of everybody else, understand things, get recording, get ahead of the game, talk to your trainer, get it done. Like this, it's actually a really good way. 2-3 weeks ago, people didn't even know whether they could see CCT on time. People didn't even know whether, what's happening with the exam. Am I going to get an extension? Whereas now you've got this opportunity to get to the end of your training on time. Grab it, see it as an opportunity, and make the most out of it. Now, how can we help you with your RCA Special COVID CSA assessment? Firstly, we're going to be doing lots of regular videos like this one to keep you up to date with changes. There's probably going to be new changes coming out quite regularly, new guidance coming out, and whatever comes out, we'll get it first to you across all of our social media streams. Number two, our virtual RCA CSA style immersion courses. We've redeveloped our whole CSA course targeted specifically to the RCA. We've got 2 dates released already. The first one is almost full. The second one is already half full. Have a look at the website, auroramedicaleducation.co.uk, and have a look at the dates and what we cover. It's a long day, it's virtual, you attend from home, and we're going to focus on live role play and live feedback based on the 3 types of scenario that you need to be doing: face-to-face, video consulting, and telephone consulting, looking at how can we squeeze in all of those core elements to try and cover A, the breadth of what the curriculum is looking for, and B, focusing on the 3 key domains that you will be assessed on: data gathering, clinical management, and interpersonal skills. Have a look at the website, auroramedicaleducation.co.uk, and try and get yourself booked onto one of our virtual RCA courses designed specifically to try and maximize your score in RCA. Hopefully, we'll get to see you on that course. Hopefully you'll get to follow all of our other update videos, whether you're watching this on YouTube, Twitter, Instagram, Facebook. Have a look at Dr. Aman Arora. We'll do so many more videos to try and get you A, into the zone for this exam or assessment, and B, some tips to keep you updated. You know the hashtag, can't pass, will pass, hashtag I went with Arora. I'll see you hopefully online soon.